Welcome to the Propaq MD CPR Feedback module. CPR D-pads or CPR stat pads, electrodes, provide a chest compression sensor that is located between the rescuer's hands and the patient's lower sternum. The sensor monitors the rate and depth of chest compressions and sends this information to the Propaq MD unit for processing and display. Once the Propaq MD is connected to defibrillation electrodes with the CPR sensor, the CPR dashboard will automatically appear after 5 to 8 compressions. On the CPR dashboard display, you have several critical items which will allow you to obtain real-time CPR feedback. First, you will notice a bar representing each compression. The top solid line represents the baseline. The first dotted line represents 2.0 inches, 5 centimeters, and the second 2.4 inches, 6 centimeters. Keeping the bar within the dotted lines lets you know that your depth is correct and within the current guidelines. You will also notice numeric readings of depth and rate to further assist you in meeting the AHA ERC guidelines. You will also notice that the values change color when outside of guideline recommendations. Next, you will see a release indicator, which lets you know whether or not you have come fully off the chest. When the bar is full, you have allowed for full recoil. The Propaq MD unit can be configured to display the text prompt, Fully Release, which instructs rescuers to lift their hands from the patient's chest after compressions to allow full recoil. This prompt occurs 45 seconds into the CPR interval. By default, the Fully Release text prompt is not enabled. The Perfusion Performance Indicator, or PPI, lets you know that both rate and depth are within current guidelines. Like the release indicator, you want to keep the PPI shape full. The PPI also gives you an excellent indication of the detrimental impact of pausing. As soon as you stop compression, the shape empties quickly. Some describe this phenomenon as being like air coming out of a leaky balloon. Above the PPI, you will see the CPR timer, which counts down 2 minutes, letting you know how much time remains before pausing to verify the rhythm and shock if necessary. When CPR is paused, the CPR timer quickly becomes an idle timer, which lets you know how long the patient has been without blood flow. The idle timer will start after 10 seconds of no compressions. The Propaq MD unit can be configured to issue voice prompts related to the depth of chest compressions as feedback to rescuers performing CPR. 2 voice prompts are available for this purpose: Push harder, and Good compressions. This is not a default setting. When chest compressions are detected but their depth is consistently less than the target depth, the device periodically issues the Push Harder voice prompt. If the rescuer responds by increasing compression depth to more than the target depth on a consistent basis, the unit issues a Good compressions prompt. The Propaq MD unit includes a CPR metronome feature that can be used to encourage rescuers to perform chest compressions at the AHA ERC recommended rate of at least 100 compressions per minute. This metronome can be configured to operate in both AED and manual modes, or in AED mode only. It can also be disabled for all modes. When activated, the metronome beeps at the AHA ERC recommended rate to provide a compression rhythm for rescuers to follow. The metronome is silent when chest compressions stop being detected by CPR-equipped hands-free therapy electrodes. Propaq MD has See-Through CPR, an amazing technology available only from Zoll. See-Through CPR filters out the compression artifact, allowing you to get a picture of the underlying heart rhythm without stopping CPR. You can see the top trace is the ECG with artifact. Immediately below, where it says Filt ECG, is the view of what's going on under all that noise. At the end of the 2 minutes of CPR, you still have to verify the rhythm before determining whether or not a shock is necessary. But Through CPR has given you a pretty good idea about what is going on, so the duration of the pauses will likely be minimized. As the AHA-ERC guidelines emphasize, minimizing pause time can decrease hands-off time. The filtered ECG is not automatically configured to appear. It must be inserted manually. You have reached the end of the Propaq MD CPR Feedback module. For details on other compatibilities of the Propaq MD, please review those separate modules.